Have you ever heard of dysplasia? It's a group of rare diseases that can seriously affect bone development and function. Dysplasia can cause bone deformities, uneven limbs, persistent pain, and an increased risk of fractures, even with minor injuries. Early detection is crucial as it can significantly improve the quality of life and the effectiveness of treatment. Today, I'll guide you through recognizing and treating skeletal dysplasia. But first, don't forget to like, share, and subscribe to stay updated on all things bone and joint health. So what exactly is skeletal dysplasia? It's a group of genetic or congenital diseases that cause abnormalities in the development and structure of bones. Why is it dangerous? Well, it weakens bone structure, making bones more prone to fractures or deformities. It can affect height, mobility, and is sometimes linked with other systemic diseases. Who's at risk? Children born with congenital bone abnormalities, and some adults, since certain forms of dysplasia may not be detected until later in childhood. Now let's talk about the symptoms. Early signs include abnormal bone growth, where limbs aren't the same length, chronic bone pain without obvious trauma, fragile bones, and abnormal spine curvature causing back pain or breathing difficulties. What causes bone dysplasia? The main culprits are genetics, specifically gene mutations, a deficiency in collagen or proteins related to bone structure, and environmental impacts or diseases during pregnancy. Some common types of bone dysplasia include osteogenesis imperfecta, where bones are easily broken from a young age, achondroplasia, which causes congenital dwarfism, and fibrous dysplasia, leading to weak and easily deformed bones. How is bone dysplasia diagnosed? Diagnostic methods include genetic testing to check for gene mutations, imaging tests like X-rays, CTs, and MRIs to evaluate bone structure, and biochemical tests to identify signs of osteoporosis or metabolic disorders. Let's move on to treatment options. Medical treatments may involve supplements like calcium and vitamin D to boost bone density, and anti-osteoporosis drugs if there's a high risk of osteoporosis. Surgical treatments could include orthopedic surgery for severely deformed bones and bone grafting if significant bone tissue is lost. Physical therapy and rehabilitation are also important. Gentle exercises can help maintain mobility, and splints or support devices can prevent further deformity. Remember, skeletal dysplasia isn't a death sentence, but early detection is key for the best treatment outcomes. Regular bone and joint health checkups are essential, especially if you notice any unusual symptoms. Want to know more about rare bone diseases? Drop a comment below, and don't forget to like, share, and subscribe for more valuable health information.